Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with this edition of the Dr. Bob Rakowski podcast. I've got Dr. Ayla Wolf here, and I've got to tell you, we were having an interesting conversation before we started. She's a brand new author with something that really resonates with my soul and is very needed. Her book is The Concussion Breakthrough, and the subtitle, Discover the Missing Pieces to Recovery, which, by the way, if you don't recover, there's always a missing piece. So you have expertise in traditional Chinese medicine. One of my great mentors, who I'm known more from afar than up close, Dr. Ted Carrick, and you are an associate professor at the Carrick Institute, which I think does some of the absolute finest work in terms of functional neurology.
Yep.
So, welcome. And where do you want to start? Where did this journey, what would you call the starting point of what led to you being right here, right now?
Sure. I could make the story super long, but I'll try not to. I'll try to do the cliff notes. I've been an athlete my whole life, and so I have racked up quite a few sports-related concussions over the years. And I've been in private practice as a Chinese medicine practitioner, as an acupuncturist for 19 years now. But the first 7, 8 years, I specialized in fertility and women's health. And so I say that to say that neurology was never, like, initially an interest of mine or on my radar, and I was more concerned with trying to help women who were trying to get pregnant. And during that time, racking up my own concussions, I developed post-concussion syndrome. Definitely a lot of brain fog, trouble with focus, attention, really poor sleep, probably some anxiety, a lot of what I might call non-specific symptoms that at the time I didn't even realize was a result of multiple concussions, two that had happened 10 days apart from each other. And because I do a lot of sports where you're wakeboarding or downhill, mountain biking or snowboarding, there's no athletic trainers on the sideline watching your every move. And so with all of my concussions, nobody was ever around. So I never really got properly diagnosed. I never got properly treated. I would never got properly evaluated. And so I was very good at just compensating and trying to do life. Um, but the thing that actually I had a light bulb moment where, do you remember the movie with Will Smith, the concussion movie, about the NFL? So that movie was actually, kind of based on a book called The League of Denial, and the book was a phenomenal book written by a journalist kind of researching this topic on CTE and the NFL, and so when I read that book, and I'm not even sure how it came across my plate at the time, but I'm an avid reader, and all of a sudden this light bulb went off, and I started to realize, wait a minute, I could trace back all these different moments in my history where I had some kind of, mountain biking crash or snowboard crash or wakeboard crash or getting kicked in the head at a karate tournament and saying, "Oh, I remember having dizziness and disorientation and nausea and feeling out of it," and suddenly recognizing, "Wow, I've actually had a lot of concussions." And so it was that reading that book that really started me on my journey to understand, I is are all of these concussions what are causing my symptoms? And obviously the answer was yes. And so that led me on a journey to literally sell my practice and move to Texas, go back to school, get my doctorate degree, and during that time, basically study brain injuries, concussions, and learn everything I could about the brain. And I actually, while I was in my doctorate program, I enrolled in a master's level neuroscience course at UT Dallas. And during that time, I recognized that a lot of these kind of college level neuroscience courses, they're very textbook and they're not focused on clinicians and clinicians working with patients. And so I got invited to go to the Carrick Institute's very first International Symposium of Clinical Neuroscience in 2015, which was dedicated to brain injuries. And when I went, I walked into a room of 200 of the smartest people in the world, talking about brain injuries. And from that moment on, I was hooked. I said, I need to know everything these people know. I'm going to spend the rest of my life studying this if I have to. And so that led me down the very deep rabbit hole of functional neurology, the Carrick Institute, studying everything Dr. Carrick had, as well as all of the other fantastic professors that are there.
Yeah, I want to jump into some of what's possible and maybe even a little more background. So you mentioned some symptoms that you had that you realized, oh my gosh, those are concussion related. So let's go with, if someone gets hit in the head, what are the top symptoms you're looking for to see if they have a concussion? And what's the first thing they should do?
Yeah, so you've got symptoms and then you've got clinical findings, right? So if we talk about symptoms, people will very often have dizziness, nausea, headaches, maybe some disequilibrium, feeling off balance. So those are maybe some of the most immediate symptoms. But then from the clinical side, you want to be looking at a person's pupils to say, are their pupils an equal size? How are they responding to light as the pupillary light reflex? You're wanting to, look to see if that pupillary light constriction sluggish, or do they constrict, but then they can't maintain that for very long? So you're looking at some very finely tuned pupillary light reflex dynamics. And then you're looking at eye movements and, not necessarily just the classic, hey, follow my finger back and forth, but there's a lot of different eye movements, which I break down in my book. There's actually 7 classes of eye movements. And so having a more comprehensive ocular motor exam is really important. Um, the two eyes need to not only be moving correctly, but they need to be working together too, or what you call eye teaming. And many people after concussion, when you bring an object closer to their face, their eyes don't want to come in and maintain focus on that. One eye might actually kind of quit and give up, and you see it kind of shoot back out. So that's called a near point convergence test. So looking at aspects of pupils, eye movements, how are the eyes working together? People can actually have issues with their peripheral visual processing. So not necessarily like they've lost peripheral vision, but the way their brain is processing movement in the periphery can change. You want to look at balance in a lot of different parameters, not just, hey, can you stand with your feet together and your eyes closed? But what happens if you're standing in a tandem stance, or if you're standing on a foam pad and taking away the ankle input? What happens if your head is in extension or flexion or right or left rotation? Does your balance break down in some of these other parameters? So we're looking at all of that, and then the autonomic nervous system. And that's, I think, a big one that gets missed, is that people can have symptoms of dysautonomia or autonomic nervous system dysfunction that can go missed for a very long time, because that kind of dysfunction also can lead to a lot of non-specific symptoms like nausea that just comes and goes, or just kind of a feeling of orthostatic intolerance of like, the longer I stand up, the more I just don't feel good, or just kind of generalized senses of anxiety, or headaches can result from that too. So um, a lot of those symptoms kind of, that when people just focus on the symptoms instead of actually testing the systems, a lot of this stuff gets missed.
So you're very thorough about that. I like that. And so, I've always been under the mindset there's no such thing as a mild concussion, but you could get a slight hit in the head, or you could get something that is more serious. Do we base it on how hard the person felt to get hit, or the symptoms they saw? Or are you just saying you get hit in the head, go to a specialist? What's your guideline on that?
Yeah, so a lot of that also comes to terminology. When we talk about just the word traumatic brain injury, we can say that 90% of all traumatic brain injuries are concussions. And if we want to use the term mild traumatic brain injury is often used when it comes to the research on veterans and active military. And so the term mild traumatic brain injury often is used in research, and so then it gets people get confused. Like, is that different from a concussion? With if you're using the Glasgow Coma Scale, a mild traumatic brain injury, or if people score 13 to 15, it's considered mild, right? And so that's partly where this word mild comes in. But the term mild doesn't equate to the symptoms being mild. And so that can be confusing for people. And one of the subheadings in chapter 1 of my book says mild traumatic brain, mild doesn't mean that the symptoms are mild, um, and kind of breaks that down. So a lot of times when we use the word concussion, that's kind of being used in like more of the sports medicine world. When we're talking about civilians and military, often the word mild TBI is being used, but I'm just going to use these kind of interchangeably for the sake of saying 90% of all traumatic brain injuries fall into this kind of concussion category. A lot of the research where they had sensors in the football players' helmets, they didn't find a very clear correlation with the amount of G-force and whether or not they got a concussion. And so how hard you get hit doesn't necessarily equate to how bad the concussion is or how symptomatic somebody might be. What we do know is that once you've had 1 or 2 concussions, it doesn't take very much force to kind of get a 3rd concussion and bring on symptoms. I've had probably 10 concussions at this point, and a couple years ago, I was in my pole barn putting something away, and I stepped forward. It was dark in there, and I stepped on a landscaping rake, and the metal pole just banged me right in the head. And I didn't have whiplash. There was no rattling of my brain. It was just a metal pole to my head, and my head didn't move. But that was enough to make me feel a little out of it, a little dizzy, a little nauseous. And for 2 months after, some of my old concussion symptoms came back. I found that I was stuttering a little bit, and I found that I had a little bit more word searching. And when I would stop my car, I would feel like I was still translating forward. And those were all old symptoms that I had had previously that had gone away. So for me, all it took was just getting a bonk on the head from a landscaping rake, and it was enough to bring some symptoms back for 2 months.
Now, there's so many different things. So I want to talk about blending traditional Chinese medicine, acupuncture, meridian therapy, maybe even Chinese herbals. But there's also some pretty unique neurologic retraining, is what I'll call it, that Dr. Carrick is pretty famous for. So, do you have some in that category that you want to share that are quite interesting and maybe almost universal for people post concussion syndrome?
Absolutely. I think one of the things that Dr. Carrick has done so well is he's done cross-disciplinary research. And so not only is he an expert at all things related to eye movements and eye movement disorders, but also how the vestibular system operates and how the vestibular system is yoked to the visual system, and then how the cervical proprioceptive system plays such an integral role as well. And so a lot of the brilliance of what Dr. Carrick has taught over the years is being able to understand how these sensory systems communicate with each other and how an error in one system creates a sensory mismatch that then causes a lot of symptoms that people have in terms of eye strain, eye fatigue, headaches, neck pain, all kinds of disequilibrium and balance issues, vertigo, dizziness, and then all these otolithic symptoms like rocking, swaying, feeling like you're on a boat. And so a lot of the functional neurology work that I do is in testing all of these different systems and then looking for errors in these systems to say, how can we clean up these sensory errors so that the brain understands exactly where the head is positioned in space and how it is moving and how fast and how far so that people don't have these symptoms.
You said a lot there that makes all perfect sense to me. Now let's go with some of the interventions. So let's break it down system by system. If my eyes aren't right, what will I do? If the vestibular system doesn't seem right, what would be one of the common things to do? And then about the upper cervical spine, what are some of your favorite things to do there?
Um, Well, because it's all so interconnected, I think maybe what makes the most sense is to say or to kinda get into maybe some of the testing that I do to look for these crossovers. And so, when I have a pair of goggles or what, people call Frenzel lenses, where the patient is in the dark, but you have cameras that can see the eyes. And so when you pop a pair of goggles on and you're looking at a patient's eyes, what's happening when they are trying to either fixate on an imaginary target or look in a certain direction, you start to see the influence of the vestibular system on the visual system. So I've seen all kinds of interesting things where you pop the goggles on a patient and all of a sudden you see that they have a downbeat nystagmus that you don't see when they're not in the dark. When they have something to fixate on, their frontal lobe overrides the nystagmus. And so you miss it. But if you're looking at their eyes in the dark and all of a sudden you see a nystagmus kicking in, you can start to find things that like influences of this vestibular system or the cerebellum that maybe you would have missed otherwise. Or like if I tell a patient and they have the goggles on and they're just looking up and down, just the other day, I had a patient where every time she thought she was looking up, her eyes were going up and to the right. And so you can say, well, this patient doesn't know where her eyeballs are in space either. They think they're moving up and down and their eyes are being kicked over to the right. And so I gave her some simple what we call like a times two viewing where a target's moving one direction and the head is moving the opposite direction. And so you can start to incorporate some head eye vestibular exercises to balance out the vestibular inputs so that they're, like I said, you're cleaning up these sensory errors that are affecting the way that their eyes are moving. Um, so that's kind of one example.
Well, I like that example. So, I'm imagining there's the whole range that people that are elite that have a mild injury, they can respond in a few sessions, and those that are chronic and not very healthy, they might take months. So, what's the range in amount of therapy sessions that you're seeing for typical to atypical to extreme to get better resolution?
Some of the biggest barriers to people recovering are if they have a PTSD and if their system is heavily in a sympathetic mode or if their limbic system is firing really high. I find that a lot of those people, their nervous system is not always in a place to receive therapy, even if it's the right therapy. So if people have a lot of stress, a lot of PTSD that's keeping them in a fight or flight, that often a lot of times you need to bring in the mental health piece too, and you need to do a lot of work to and I'm not a trauma therapist, so I refer out for like EMDR and counseling and different things that can help people neurofeedback. Um, but that's one of the biggest barriers. And then also if somebody has chronic infections, like maybe they have Lyme disease or long COVID or some of these, chronic inflammatory syndromes, that is often a big barrier as well for people being able to take an active neuro rehab program and integrate it and then fix this stuff and then move on with their lives.
I'm going to take a quick moment to go to our sponsor, bettercoffeeshop.com, the world's cleanest coffee infused with reishi mushroom, which, by the way, lowers the amount of circulating stress hormones in the bloodstream and even has some anti-infective properties. Bettercoffeeshop.com. I would suggest get a box, enjoy it. Let me know your feedback on that. So you've just brought in some really, really important things. I've taught something for decades at this point. I call it the stress reset. I use melatonin, theanine, and reishi spores, three different mechanisms to lower the amount of stress in the body. But the mental health component, we all need someone good. And, I wish that there was more functional mental health out there because too many of them are so pharmaceutically driven. The people that you refer to for mental health, do they have a functional background? Which I'm not opposed to pharmaceuticals, but generally we can do a whole lot naturally.
Yeah, I think that a lot of the patients that find me already have a mindset of wanting to find natural ways of approaching their symptoms. I certainly had people that have been on different medications, and usually the feedback I'm hearing is that they want to get off of them. And so, part of my work is saying, okay, can we reduce some of your symptoms to the point where maybe you can go back to your doctor and have that conversation with your prescribing physician. But like I said, I do refer out a lot for like neurofeedback, EMDR. I've recently learned about Set, which is a very fascinating therapy that basically using like a quantitative EEG measures your brainwave activity and then converts that into auditory notes and then plays those notes back to you. So you're laying there listening to your brain talk to itself. And in doing that, it kind of helps to reset your brainwave activity and how these different parts of the brain are speaking to each other. And it's this very gentle kind of passive therapy, almost like a mirror therapy for the brain waves. Uh,
The more we learn that plays all over. One of my favorite books, The Brain That Changes Itself, and with phantom limb, they have people actually pretend they're visualizing their hand through a mirror, and suddenly, their sensory starts to normalize. So that's what you're sharing there. Sounds like something that's just a good spin-off of things that have always worked. I think of some of the early things that I heard from Dr. Carrick. Sometimes they'd have you play music in only one ear, or they'd shake an extremity on the other side of the body, or pencil push-ups with the eyeballs is one thing that I'd done, standing on one leg, eyes closed. But it seems like it's gotten a lot more advanced in terms of diagnostics and even therapeutics. What about nutrition? Do you do much with traditional Chinese medicine with these cases?
I do, and, there's so much, brilliance in Chinese herbal medicine in terms of the sophistication with which you're creating a formula, and so I have specific herbal formulas, for example, that actually help to pull inflammation out of the glymphatic system of the brain. And so there's some very fascinating research that is saying that when you get a concussion, your ventricles actually expand to allow for better glymphatic function temporarily to flush out all of the metabolic waste from the trauma and the damage. But that when you get subsequent concussions, your brain doesn't have that response. Those ventricles don't enlarge. And so then you basically create congestion. And so when you think about people that are having lots of subconcussive hits to the head, multiple concussions, you can create some stagnation within that glymphatic system. And now all of a sudden, the garbage truck of the brain isn't working. And so when you think about how do I help the brain, I kind of see it as, well, you've got to unclog the pipes first. Like you've got to get that glymphatic system working better. And so there's specific herbal formulas that actually help to pull inflammation out of that system, and then other herbs that help to support that functioning, because a lot of that relies on vasomotion. So it's the vasomotion of all the capillaries. And so if this is a capillary, the glymphatic system has these end feet that cling to the arteries, and then as you have the vasomotion, that's what allows the water to like pump through this glymphatic system and drain out all the metabolic waste. And so having healthy vasomotion is important. So like making sure that your blood vessels aren't in spasm or constricted, having, being able to exercise to maintain healthy vasomotor activity. And then there's herbs, like I said, that can actually help to promote that, as well as PEMF. I'm a big fan of the PEMF devices for that as well. So that's kind of one example of using herbs. Another one is, people when they have headaches, if they have more of a sharp stabbing headache, I would use a completely different herbal formula compared to if somebody just says, "Oh, I just have intense, constant pressure in my head all the time." That's when I'm like, let's get that glymphatic system working better, to try to help with that.
And how about classic acupuncture, needling, meridian therapy? Do you do that as well?
I do acupuncture, but in a very, perhaps different way than, somebody who kind of practices classical acupuncture energetic approaches. I would say I have more of a kind of neuroscience meets acupuncture approach. A good example is I had mentioned, the patient that, a patient comes in, they have downbeating nystagmus. Well, the literature says that downbeating nystagmus is often having to do with midline cerebellar structures. And there's an acupuncture point, pericardium 6, on the wrist, which is traditionally used for nausea. And so when you needle that point, it modulates activity within the cerebellar, vestibular, insular cortex functional connectivity circuits. And so if there's downbeat nystagmus and the eyes are constantly drifting one way and then correcting another way, you can say there's a hyperactivity in that circuit. And so I did electroacupuncture on that point, and it stopped the downbeating nystagmus. And I'm recording this, so I have the goggles on. I have my before and after recordings. And so this is a good example of how I'm utilizing, a functional neurology approach of gathering all the information on the different systems. And I've got like my videos to show the patient, here's what's going on. Then we can do an intervention. And the beauty of, Dr. Carrick is that he doesn't care what the intervention is, as long as you have a rationale for why you're doing it and you can show that it worked. He doesn't care if it's juggling kittens or doing acupuncture or what else, right?
Well, isn't that how it should be? And I'll go it a little further. He doesn't care what the intervention is as long as you have, like you said, good rationale, and then you follow the outcome. So if you get the outcome you want, good. You put a check mark by that and say, let's try that again on another case. If it doesn't work, okay, why not? Let's find something different. And he's as good as anybody in the history of the game. But how powerful that you described, if people have ever worn those seasickness bracelets, right? They get on a boat, pericardium 6, some systems call it the circulation sex meridian, goes by multiple names. Uh, it's
Mhm.
it's powerful. It's powerful at changing both neurology, chemistry, mood, the whole bit. I love it. So neurology does meet acupuncture, does meet neurochemistry, does meet health when applied appropriately. So maybe share a few of the cases. You've worked with some pretty amazing people. I guess you worked post concussion with some of the MMA stars and things like that. I don't think we can give away names for confidentiality, but maybe share a story of maybe a wonderful outcome from this approach.
Um, yeah, my waiting room, when I was in Texas was interesting because my colleague specialized in fertility at the time, and I was doing sports medicine and working with a bunch of MMA fighters, that were in Legacy and UFC. And so at any point, our waiting room, we'd have like, a 20-year-old dude with two black eyes and then, a 40-year-old woman trying to get pregnant. And at one point, I was in the middle of a treatment, and the UFC commission came to the clinic and knocked on the door, and they said, "We're here for a random drug screen." And I was like, "Well, my patient is laying with acupuncture needles in, like, do you want me to, like, do I have to stop my treatment?" And they're like, "Yep, yep, you gotta stop that. They gotta come out and, yeah, do a piss test."
Well,
Uh,
well, I'm glad they're keeping up on them. That's good news.
I know. I guess that, like, during those 8 weeks before a fight, like, they know they have your phone pinged, like, they know where you are at all times, and they can just show up and, do a random drug test. But anyway, one of the fighters that I was working with, his coach basically said to me, "Hey, his reaction time is starting to suffer, and so, this is the thing that we need to work on." And, so some of the exercises I was having him do were to take a metronome and just practice like jumping on one foot to a certain beat. Then you go to the other foot, then you change the metronome pacing. And it's just like you're slowly kind of increasing the metronome and getting used to movement at a specific beat and then increasing that beat as one particular way of trying to increase reaction time within the motor system. But also the crazy thing is that, um, I would, look at people's saccades, their saccade eye movements, and obviously, the faster you can move your eyes, the more you're aware of what's happening and the faster your reaction time. And so there was a moment where I had a fighter come in at like 2 days after his fight, and when I looked at his saccades, they were slow as molasses. And so I did some acupuncture as a way of just improving blood flow to the brain. Again, this is 2 days after his fight, and we checked his saccades after the treatment, and it was a night and day difference. I mean, to the point where I was surprised. I didn't actually expect to see that profound of a change. Um, but so much of the way that acupuncture is supporting the brain is by increasing blood flow and increasing oxygen to the brain if you know the right points and what to do.
Well, that's the magic of life, isn't it? You get the great mentors, the great systems. Traditional Chinese medicine is around for thousands of years because it works. Neurology, certainly, you could argue, has been around for thousands of years, and then the Carrick Institute's certainly on the cutting edge. I'm going to give you the final say in terms of wrapping up because we're right at that time. But I want to say again, this has been profoundly insightful. Get the concussion breakthrough, discover the missing pieces to recovery. Because I'll tell you what, everybody knows someone who's not operating on the level of efficiency and joy and productivity they can because their brain isn't right from either a physical trauma or we even threw in the concept of post traumatic stress, which who knows, maybe to some degree we all have something like that. So, Dr. Ayla, I'm gonna give you the final words as we wrap up this beautiful and powerful conversation.
Oh, thank you so much. Well, I recognized when I wrote the book that people that are struggling with concussions often have difficulty with reading, focus, and attention, which was why I also then created my podcast, Life After Impact, as a way of kind of having more conversations on the topic. And then in chapter one of my book, there's basically a questionnaire that people can fill out. And based on how they answer that, then maybe they don't necessarily have to read the book cover to cover. They can kind of jump around and go to the chapter that is most reflective of the symptoms that they're dealing with. So I've tried to make it as user friendly as I could for people, but you know, the whole point of the book is to try to help people troubleshoot when they feel like maybe they've had a concussion, they've been to a couple of doctors, they're still symptomatic, and they're not quite sure what to do next. I think this book is going to be able to help people figure out what those next steps need to be.
I'm going to encourage everybody to get it. I'm going to get my copy. I've had a few hits to the head. I've been blessed to work with some good people, but there might still be a deficit. So I might be consulting with you as well. Thank you again. And as always, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. Let's tune up your brain by finding the missing pieces and get you your best life ever.